Hey everyone, welcome back to my vitamin B video series. Today we're going to be talking about the best way to take vitamin Bs, including some tips on what you may want to avoid when you're taking vitamin B. For those of you who are new to my channel, my name is Christy. I have been professionally treating clients with treatment-resistant hyperpigmentation, acne, and anti-aging without the use of topical medication for over 17 years. Okay, so first let's talk about the most common way and usually the most economical way to take a vitamin B, and that is going to be in a tablet form like this. Now, I generally don't recommend this way for most clients, and one of the reasons is when it's a multivitamin mineral combination all in one tablet, even though it's really convenient to take, it's going to have some things that can reduce absorption. So for example, vitamin B and vitamin C, although both of them are water soluble, should not be taken together because vitamin C can reduce absorption of vitamin B12. It's also combined not only with vitamin complex B's and C is magnesium. Now, even though vitamin B's generally it doesn't directly produce energy, but it does play a key role in helping to increase energy levels in the body. So when you have that, and then you're taking magnesium, which usually helps to relax you, it's a push and pull effect. So typically, I recommend taking certain vitamins at certain times and minerals later part of the day. Now, the second level is going to be an easier way to digest it, and that is going to be something like this, where it is in a powdered form, encapsulated in a cellulose-based capsule, right? Where you can pull it apart and put it in water, or you can just take the whole capsule. Okay, so that's the second level. I recommend that for most people. Now, for people who take medications, for people who are sensitive to being nauseous, or you have a vitamin B12 deficiency, like you've actually taken a test. And typically people who have autoimmune disorders, such as celiac disease or some form lupus or Hashimoto's, typically you're going to be lower in vitamin B12. So you can take this in a liquid form. Now, some studies have shown that if you take a very high dosage of vitamin B12, that is just as effective as taking it as a shot or intramuscularly. Okay, so this one in particular has 5,000 micrograms. It is equivalent to 208,330 percentage. And as you can see, it's not a tablet, it's a liquid form, and you take it in the form like in the pipette. There's even a marker of how much you need to take. And what you do is you put it in your mouth and you swish it around for 15 seconds and then you swallow it. So some part of it is going to be absorbed in the mucosa of the mouth as well. So I tend to take this. This has worked better for me. And for some people who have incredibly sensitive stomachs, if you have, so blood type A, B, and AB have been shown to have lower amounts of stomach acid. So typically those types tend to do better, right? Because there's so many variabilities, tend to do better with a liquid form. Okay, so that is another tip. Now let's talk about some things that you cannot avoid, like taking medications that can reduce absorbency of certain types of vitamin Bs. Now, I'm not going to talk about the specific medications that can lower vitamin B levels. That is another video that I did, and I'll put the link up above or below if you're interested in that. What I am going to talk about is, because medication has been known to reduce vitamin B levels in your body, it is best to take it with the advisement of your doctor or your healthcare practitioner, is taking it a few hours before or a few hours after that you have eaten. So is it better to take a vitamin B12 by itself or complex vitamin Bs? And that depends. First, you always want to consult with your healthcare practitioner or your doctor, because there's all kinds of variables. So generally speaking, people who have medical conditions that involve their liver, diabetes, they have GI tract issues, they're taking medications. These are all factors that can just reduce all the vitamin Bs in your body. So after consulting with them, I generally would recommend taking a complex B vitamin. Now, what are some factors that in addition to those things can reduce absorption of vitamin B in your body? So it can be coffee and tea, especially if you've drank more than 2 cups a day. Alcohol can reduce vitamin B absorbency, as well as shellfish and raw fish. That involves an enzyme that can actually inhibit the breakdown of thiamine.